Hello friends, today we're talking about the lumbar vertebra. So I'm going to describe it through some processes. Okay, at first we know the identification points, then we are going to the parts. After that we have to know the anatomical position, and then we have to going through the anatomical position with the attachment. Since we are now starting with the identification points, the large size of the body, which is wider transversely to antero-posteriorly, okay, and then the absence of the costal facet, and then the absence of the costal facet, and then the vertebral foramen, which is triangular in shape. The vertebral foramen, which is triangular in shape, it is larger than the thoracic level and smaller than the cervical level. The pedicles are short, and the spinous process, which lies quadrangular and horizontally to the friends, we have to know the anatomical position about the lumbar vertebra. At first we have to hold it in anatomical position like this, and then the anatomical position of the lumbar vertebra is the body is directed forward and the spinous process is directed backward in the horizontal plane. Then the superior articular facet, which is convexity, directed backward and medially, and the inferior articular facet is with its concavity directed anteriorly and laterally. Now we are going to the parts. This is the body, and there are some processes. That is the transverse process, and then the spinous process, and then superior articular process, and then the inferior articular process. So in the body there are two surfaces, the anterior surface and the posterior surface, and the two borders, upper border and the lower border. So now we are going to the attachment of the body. In the body there is anterior longitudinal ligament. In the posteriorly there is a posterior longitudinal ligament, and then we are going to the lamina. There is a attachment of the ligamentum flava, and now we are going to the spinous process. There is a attachment of 4 muscles and 2 ligaments. The muscles are the thoracolumbar fascia, erector spinae muscle, multifidi muscle, and spinalis thoracis muscle, and the 2 ligaments are interspinal muscle and ligament, and also the supraspinous ligament. So now we are going to the transverse process. The transverse process have two surfaces, anterior surface and the posterior surface, and the medial end and the lateral end, and the upper border and the lower border. There is the anteriorly there is a thoracolumbar fascia, and the posteriorly there is a longismus thoracis, and the upper and lower border gives the attachment of lateral intertransverse muscle, and then the medially there is a psoas major muscle, and the laterally there is a quadratus lumborum muscle. Now we are going to the mammillary process, which is situated just behind the superior articular process. This is the mammillary process, and here is the attachment of the multifidus and the medial intertransverse muscle, and there is also the accessory process just behind the transverse process. Here is the accessory process, and here is the attachment of the medial intertransverse muscle. So I tell the all attachments and all the features of this. Friends, now we are starting with the fifth lumbar vertebra. At first we have to know the identification points about this fifth lumbar vertebra. So it is the fifth lumbar vertebra and it has some special identification points. It has a massive transverse process that is continuous with the whole of the pedicle and encroaching on the body. And then the body is usually largest of all the lumbar vertebra. You can see that is the fifth lumbar vertebra have massive body, and it is marked deeply anteriorly and contributing to the lumbosacral angle. In the downwards there is a sacrum, so there is the formation of the lumbosacral angle. The distance between the superior articular process is less or equal to the distance between the two inferior articular process. It means the distance between the superior articular process is equal or same between the two inferior articular process. This, and then we are going to the anatomical position of this fifth lumbar vertebra. The body is lie anteriorly, then transverse process inclines upward and it passes laterally, then superior-laterally, and then superior articular process facets directed backwards and upwards. Now we are going to the attachment of this fifth lumbar vertebra. In the tip of the apex, in the transverse process, here is the attachment of the iliolumbar ligament, and to the lower border of the transverse process there is a, here the lower border, there is a attachment of the lumbosacral ligament. Now the contents of the fifth lumbar vertebra foramen. Here is the conus medullaris of the spinal cord, and then chorda equina and spinal meninges of the lower foramina here. Now we have to know some excess things about this fifth lumbar vertebra, that is the anterior relation of the fifth lumbar vertebra. There is a anterior longitudinal ligament and then psoas major muscle, both common iliac arteries, both common iliac veins, formation of the inferior vena cava and median sacral vessels, and at last there is a sympathetic